Vicky MD Show. I'm Dr. Vicky, and I'm excited to share some of my life and career stories with you. I'm a physician and an American descendant of the enslaved, and my slave family name is Mabry Height. I've practiced internal medicine as a board-certified physician for over 30 years. I'm also an author and an educator. On the Dr. Vicky MD Show, I'm going to share some lessons I've learned throughout my career and personal stories that I hope will educate, inform, and sometimes entertain you. We'll also discuss hot social topics from a Black woman physician's perspective. And finally, I hope my stories will inspire and empower you to achieve your dreams. So be sure to tune in and join the conversation.
You have something special. You have greatness in you. Hello, I'm Les Brown, and I am just honored and excited to introduce to Dr. Vicky. The Dr. Vicky MD Show is designed to inform, to educate, and to provide information that people need now more than ever before. People are really dealing with all the mixed messages when it comes to their health and all of the things that have happened during the pandemic and the news coming out constantly about new viruses. And this particular show is going to be focusing on an area that Dr. Vicky is going to share that I know that you and some of your family members and friends are concerned about. So we want you to like this page and share it. Like it and share it because it's going to be informative, it's going to be helpful and engaging. And we ask for your participation as well. And so now here is Dr. Vicky Height. She is a person that I have a great deal of respect for, a person who's informed and knowledgeable about things that we all have concern about. And she has the ability to explain concepts to you that you can understand in layman's language. Einstein said that genius is the capacity to make the complicated simple. And she has the capacity to do that. Dr. Vicky, how are you?
I'm great. And I want to give all the praise and thanks to you, Mr. Brown, for encouraging me to
Dr. Vicky, you
hold
went
on.
off camera.
Yes, okay. I don't know what
Yeah.
happened, but
Okay, go ahead.
I wanted to thank you for brainstorming and creating this opportunity for me because it certainly wasn't something I thought of, but it was
Mhm.
something that I wanted to do. And I think it will give me a voice and an opportunity to make a difference in some of the lives of some of the listeners.
Fantastic. Well, as they would say, take it away. Come on, Frank, what's going on? All right.
Oh yeah,
So you
well,
have it.
Okay.
no, it's technical difficulties on her end, but I'm gonna add Lauren, and we're gonna continue the show. It'll all
Okay.
work out. Thank you so much, Les Brown. We really appreciate you.
Okay. Can we add Dr. Lauren Smith? Good morning, Lauren Smith. We have Dr. Lauren Smith with us today. She is a physician and an infectious disease expert, and she's also a postdoctoral research fellow who's working with the University of Maryland. And the focus of her research is COVID-19 surveillance and contact tracing and for acute care hospitals. Welcome, Dr. Smith.
Thank you. And thank you so much for inviting me and having me.
So we're going to get started. We're talking today about monkeypox. So tell us a little bit about what is monkeypox and when did it actually get started here in the United States?
Yeah, that's a good question. It's monkeypox has really been a lot in the news lately, and we've been hearing about it a lot more. But monkeypox is by no means a new disease. It's an orthopox virus, and it's an orthopox virus that's really similar to smallpox. They're basically considered cousins of each other. We've known about monkeypox since basically the 50s when researchers found it in monkeys. And it's something called, it's a zoonotic disease. So it's a disease that can start in animals and then you can get it from an animal. So it can go from an animal to a person. So it's been around. We've known about it since at least the 50s. And the reason they called it monkeypox was actually because the researchers found it originally in monkeys in the 50s. But monkeys aren't generally the people, or monkeys aren't generally the animal where it lives. It actually lives a lot in rodents and rodents that live in West and Central Africa. And so we first found it in humans actually in the 70s, and that was in the Democratic Republic of Congo in the DRC. And they actually found it there when there were a lot of efforts ongoing to eliminate smallpox at the time. And there are multiple types of monkeypox. There's two big ones that we mainly talk about, and one of them is actually pretty lethal, and this is the one that we commonly have seen in West and Central Africa, and about 1 in 10 people who get this type of monkeypox will die, so it can be pretty lethal. But then there's another type of monkeypox, and it's less lethal, and this is actually the type that you are hearing about a lot in the news right now. This is the type of monkeypox that's been going around in a lot of countries that don't generally see monkeypox, and it's less lethal. I think it's about less than 1% of people who get this type of monkeypox actually die from it, but it still causes a lot of pain and a lot of distress to a lot of people who get it. So monkeypox is a virus. It's a virus we've known about, and it causes a lot of symptoms. And usually the classic symptoms you'll see with it are pimples or pox all over the body. And again, it's related to smallpox. But I think the big thing that's going on and why it's in the news so much right now is because you're seeing it in places where you don't generally see monkeypox. Generally, monkeypox is really seen in Central and West Africa, and not at these numbers that we're seeing right now. And we're learning so much about monkeypox and the different ways that it spreads, specifically when it's not just in these settings. So I'll leave it there.
Okay, well, thank you for that introduction. That was quite a lot to learn about it. But how do we get it? And how is it transmitted from one person to another?
That's a really good question, and that's something that we're also still learning about. We know because it's been around for so long, there's certain things that we know about it, and we know that close personal contact, and often that's skin-to-skin contact with someone who has a lesion that's not healed yet, can cause spread of monkeypox from one person to another. So in general, that means if they have a rash, if they have a scab, or bodily fluids that are infected with monkeypox can transmit the virus from one person to the next. There's also things like touching fabrics, such as bedding or towels. So if someone has monkeypox and there's open lesions on while they're using the towel, and then someone else uses the towel or the bedding sheets, that's also a risk for also getting monkeypox. And a lot of what we're seeing right now, again, is direct close contact, and that also means intimate close contact. So a lot of people have been talking about, is monkeypox a sexually transmitted disease? And that's not how we've thought about monkeypox in the past. We've really just thought about it as people who are close to each other can maybe give it to each other, and people who are close to these animals can also get it. But now we're saying that intimate contact as well can lead to monkeypox. So when you're talking about monkeypox in this setting specifically, you have to be able to talk about sex. And that means oral sex, anal sex, vaginal sex, anything like that, hugging, kissing. If there's a lesion in that area, there's a risk that it can go from one person to another. And originally, like I said, this is a disease that comes from animals. And originally, when it actually came to the US, originally the first case that we had, I think, was back in 2003. And it's a bit of an interesting story. So, and there were 47 people who got sick with monkeypox at this time, not related to any close intimate contact or anything like that. What happened was they shipped about 800 small rodents from Ghana, and some of these rodents had monkeypox. And these rodents were kept next to prairie dogs. And in the Midwest, some people use prairie dogs as personal pets. So the rodents from Ghana had it, they gave it to the prairie dogs, and then the prairie dogs gave it to a whole bunch of people who lived in the Midwest. It ended up being 47 people, and they were likely all infected from these sick prairie dogs. So the prairie dogs bit them, the prairie dogs scratched them and had an open wounds, but there wasn't a lot of person-to-person spread. All of this was just the prairie dogs. So the outbreak was very quickly dealt with. People were giving vaccines, and it was only 47 people at the end of the day. And that was kind of that for 2003. We didn't see monkeypox again for a while. And actually, because of that, as a result of that, the FDA and the CDC actually have rules that you cannot like own or sell prairie dogs, specifically because of this incident that happened where all these people got sick with monkeypox. And some of them got very sick. And some of the kids ended up in the hospital with very bad brain disease. So it is an illness that can cause, make you become really sick. But I think the interesting is when you think about these cases in 2003, like people weren't giving it to each other at that time. It just came from the prairie dogs. And now we're starting to see that people are giving it to each other, but it really takes this close contact. It's not just you sit on a train next to someone who has monkeypox and you get monkeypox. You really have to have this close, sustained contact, because otherwise it would be much further than currently where we see monkeypox. So direct contact, close contact with lesions, again with intimate close contact. And then, and likely when people are infectious. So, and people are infectious from when they start to have symptoms until when they fully healed. But so we're still learning about the ways that you can get monkeypox. And so we say close contact, kissing, close contact is in you're having sex as well. But we're still learning. We also think respiratory secretions can cause it as well, but we don't think that's one of the main ways that you can get monkeypox. So hugging and kissing as well is also a risk factor if someone has monkeypox around you.
So, what's the best way to prevent getting it? Because we are seeing increases in the numbers.
Yeah, that's a really good question, and I think everyone we've all been through a really bad pandemic. Everyone really knows about COVID, and I think we all know the measures that we should take to prevent ourselves from getting COVID, and those are actually very similar to the things that you should prevent to prevent yourself from getting monkeypox. So there was a question that I kind of saw: is there a vaccine for monkeypox? Yes, there's a vaccine for monkeypox, and part of the reason that there's a vaccine for monkeypox is A, we've known about it for a while, and B, it's so similar to smallpox, and smallpox is a disease that we were able to eradicate because we had good vaccines. So we have good vaccines for monkeypox, and we had it before this outbreak even occurred. So vaccination is one of the best ways you can protect yourself. Unfortunately, there's a shortage of vaccines right now, and so we're really trying to stretch them to make sure that all the people who need them can get the vaccine. So because there's a limited supply, there's certain criteria that you have to meet and able to get a vaccine. So they're being given out by public health departments. But what we've seen of the current outbreak is that 98% of people who are testing positive are men, and it's generally in the LGBTQ plus community, specifically gay men or men who are having sex with men. So right now, a lot of places have eligibility criteria for can you get the vaccine. Generally, they're giving it to gay men, bisexual men, men who are having sex with men. It's also offered if you live or if you've ever been exposed to someone with monkeypox, they'll also offer you the vaccine. And then just people who don't know their status of their sexual partners a lot of times can also get the monkeypox vaccine. So again, just like COVID, the best way to keep yourself from getting this disease is to get vaccinated, especially if it's offered to you. The second thing is wash your hands. Washing your hands is great for preventing a whole bunch of diseases. Monkeypox is absolutely no different. Wash your hands regularly. You can also use alcohol. That's perfectly fine as well. And then the other thing, which we've learned with COVID, is if you're sick and having symptoms, don't go around other people because you're putting other people at risk. So if you have a new rash, specifically if you have a new genital rash or even just a rash that you're worried about, call your doctor and you can talk with them about what things that you should be doing. Testing has become more widespread. It's actually not too hard to get a monkeypox test right now. It's an easy swab that they send off and you get the results in a couple of days. If you have a doctor, you can go to your doctor and they'll let you know how to get tested. If not, if you don't have insurance, the local health departments will be able to coordinate as well. So if you have any symptoms, if you have any question of whether this could be a monkeypox infection or not, just ask somebody, and it's really easy to get tested. And then they'll also tell you if you have a rash, make sure the rash is covered at all times, make sure that it can't come in contact with anyone else. And then if you have a rash, avoid close contact, especially sex, until you're tested. And also wear a mask as well. So wash your hands. If you have any symptoms, stay away from other people and seek help from a healthcare provider. And then if you're eligible for the vaccine, get the vaccine.
Now, is this one of those diseases that also gets reported to the public health department?
Yeah, that's a good question. It 100% is. And generally, the way it works is whenever you have a positive test, the positive test is automatically either through your physician or the local health department reported to your jurisdictional health department. And the reason that they do that and the reason why we want this to be a reportable disease is that we have to be able to act on that. And so that means if you test positive, we're going to contact trace you the exact same way that we would contact trace you during the beginning of the pandemic with COVID. So they'll ask you certain questions. Who have you been around? Who your sexual partners are? How long you've been sick? And to do that, they have to know that you tested positive. And the reason that they contact trace is to contact anyone who you may have been in contact with, let them know to watch out and see if they have any symptoms. And the other thing that they can do is we have this vaccine, so we can offer other people who you've been in contact with vaccine. And the vaccine, as long as you get it within a couple of days, your chances of actually having monkeypox go down. So it's reportable so that we're able to really contact trace. And the other thing is just making sure that you have access to treatment. There is treatment for monkeypox, but the only way we know to treat you is if you test positive. So it's reportable, but there are good reasons for that. And then the other reason it's reportable is because we want to know how many cases we have here in the US and where those cases are. So that way, if we're telling people they need to vaccinate, we're going into those communities and making sure that we vaccinate the correct people.
Okay. Now, I want to share with the audience a slide because this is a disease that also we haven't heard a lot about it. But the numbers are constantly rising. So, for example, in New York State, July 22nd, there were 990 confirmed cases. And this is information off the Center for Disease Control website. And now, as of August 22nd, those New York numbers are 3,403 cases. In California, there was 356 cases in July, and now we have 3,833 cases. So the numbers seem to be significantly increasing. What do we attribute that to? Because we really don't hear a lot about this infection. My concern is, having lived through the AIDS epidemic, that's something that we didn't worry a lot about initially because it was sort of limited to gay men. But then all of a sudden it exploded and we ended up with millions of people, even 1.2 million who are now living reportedly here in the US that have HIV. And they say there's still 35,000 new cases every year. And we all know that there have been hundreds of thousands of deaths related to HIV-related illness. So my concern is that even though these numbers, no one's really talking a lot about this, but the numbers, if you look at them, they are significantly increasing. What is your take on that?
Yeah, I'll say there's never been an outbreak of monkeypox this large before and in this way, where we're concerned that it happens with close contact, especially close contact during sex. I think there's about 54,000 people in the world who've been infected during this current outbreak, and I think 20,000 of those are in the US. So the US, unfortunately, has an exceptional amount of people who've tested positive. And there's probably a lot of reasons for that, including our healthcare system and how disenfranchised some people are within our healthcare system. I will say that these are undercounts. I think everyone has agreed that these numbers are probably much larger. These are only the cases that we've been able to find and to convince to get tested and who test positive. So I think there's probably a large portion of people who just never got tested, had one, like a small rash or one lesion and one pimple, didn't think anything of it, and then went about their daily life. There's probably these numbers are undercounts, if you ask me. I think the percent positivity, so the percent of people who tested positive getting for a test was way too high for us not to be missing more people who just didn't realize that this was a disease and just thought it was something else. And in general, this lasts for 2 to 4 weeks. So the pimple probably got better, and that was that. So these are undercounts. I'll point that out. I'll also say that there is some good news. It seems that the last week or so, the numbers, I say this tentatively, but the numbers have started to go down some. And I don't know if there's a specific reason why the numbers are going down. I think there's a big push from public health to do certain measures. There have been a lot more vaccines that have been going out lately. People in the gay community and the LGBTQ plus community are very aware and educated about the risk of getting monkeypox. So I think a lot of people have changed the way that they're doing certain things just because they don't want the risk of getting monkeypox. So the numbers look bad. It's never been this bad before in terms of this disease, but it does seem like at least for the past week we're headed in the right direction. And you mentioned the HIV/AIDS crisis, and I think that's fair to bring up for a couple of reasons. Um, and yes, HIV is a really bad disease that's gotten worse in the last couple of years, and there's a lot of new infections. I'd say that there's a lot of similarities between monkeypox and HIV, and that both are infections that spread between close communities. And a close community or a close network, that could be a sexual network. And anyone has the potential of getting monkeypox. Anyone can get it. And we know that because before this outbreak, there were people who were getting it from prairie dogs. There were people who were just in houses with other people who got monkeypox. So it's not just one community who can get monkeypox, even though right now 90% of these people are men, and they are men who are having sex with men. So it's not just within one specific community. But I think it's similar to HIV in that it can exploit the vulnerabilities that we have in communities, specifically structural racism and homophobia. So you brought up HIV, and we know that in the gay community in the beginning, there was a lot of stigma, and that led to a lot of catastrophic outcomes in the community. We know that there's a lot of stigma against gay men, and that specifically if you're living with HIV, you're more prone to depression and putting yourself in situations that are risky for your health because you're so disenfranchised. And we know that if you have HIV and there's stigma, it's harder to access care and treatment. And a lot of that is because of homophobia. And I know in the beginning, there wasn't a lot of data specifically with HIV about the Black community. But then when we got it, we saw how badly the Black community was doing as well, and how disproportionately it affected Black people as well. And part of that, again, is just poor access to care and lack of outreach efforts, specifically within the Black community. And again, this is all part of structural racism. This is all part of homophobia. And I think even today, you continue to see the effects of homophobia, specifically in the community of HIV. There was a judge in Texas today that ruled that employers don't have to provide basic health coverage for medications that can prevent individuals from getting HIV. So your risk of getting HIV decreases 99% if you take one pill a day or if you get a shot in the butt every couple of months. But that judge said that doesn't have to be a part of your healthcare plan. And they did it because this religious organization said that giving this medication to people would facilitate and encourage homosexual behavior. And we know that anyone can get HIV the same way that anyone can get monkeypox, but this is homophobia, this is discrimination. And as a direct result, more people will get HIV within the LGBTQ plus community and without. And we know that 1 in 5 people who are testing positive for HIV today are women. So I think in talking about monkeypox, like we have to take these lessons that we learned so painfully from the HIV epidemic, and we have to make sure that people feel comfortable and empowered to seek testing, treatment, and vaccination, and that they're able to do it without fear of discrimination or stigma. So I think even the data that we have, you put up great CDC data. I think there's also, they started putting up the socio-demographic data as well on race. And unsurprisingly, the same way with HIV, the same way with COVID, the majority of people who are getting monkeypox are Black. In my state, 60% of individuals who have monkeypox are Black. I think nationwide it's 30%, which overrepresents Black people, period. So we have to do better at making sure that our vaccines, that our treatment go to the right communities and the right community organizations. And we just have to be diligent in making sure that everyone, regardless of their race or sexual orientation or gender, is offered good health care.
Well, those were some great points. One of our viewers wanted to know, how long do you need to quarantine, and is that really part of the treatment if you do have it?
So generally, you have to quarantine until all the lesions are gone, until you have new skin, because the lesions are pretty infectious. So we tell people don't be around anyone until those lesions have healed and you have new skin. That generally takes anywhere from 2 to 4 weeks. And we do tell people, please isolate, don't be around other people. We know that's not always the case for everyone, and there are different reasons for that. But if you have monkeypox, you should stay at home. You shouldn't be around other people. And if you are around other people, you have to make sure that the rash is covered up with clothing and that you're wearing a mask, and try not to be around other people.
Okay, now I didn't show any pictures of the rash because I don't know who would be watching this show, and some people don't like to see things like that. But it's basically, I think, sort of a pox type lesion where it's raised and sometimes there's pus in it, and the person can have different stages of it. Some that are new, some that are healing, some that may have scabs on them. And even those scabs, from what I understand, are teeming with the virus. And but can you describe, other than just the rash, which can be in the mouth, from what I understand, on the palms, on the soles of the feet, and in the genital areas, as well as any place else, but that's primarily where they're being seen. What are the other symptoms that people should be aware of, if we could just emphasize those
Yes.
symptoms?
That's a good question. I think you're right. It shows up, classically, it shows up as pox all over the body. So you'll get pimples in different stages all over the body. Some people had hundreds of them. In this outbreak, we're not so much seeing that. We're seeing a lot of people who have maybe 1 or 2 pimples, maybe 10, and they can be anywhere. They can be on your hands, your feet, your face. We're seeing a lot of it. I think a third of people had them in their genital region this time. There are other symptoms. Classically, people get fever, chills, just overall fatigue. Their lymph nodes will be swollen. They'll have muscle aches and pains. We're not so much seeing that this outbreak, but there are a group of people who just say, "Oh, I had fevers, I didn't feel well," and then get a rash. So in general, we're really looking for people who have this rash, but there are other symptoms: fevers, chills, and just not feeling well. Very much flu-like symptoms.
Okay. Okay, well, we certainly thank you for all of that information that you provided today. It's a lot to take in. I was especially interested in also the racial breakdown. I didn't know, and I hadn't seen any data yet on the racial breakdown. So I was surprised to hear that 60%. Is this in Maryland where you're
This is in
located?
this is in the state of Maryland, where I'm located, but the CDC also has that data, and I want to say it's
Okay.
30% of people who test positive in the U.S. Are Black, but I'm not entirely sure on that statistic. But Hispanic and Black people have higher rates of monkeypox right now.
Okay. Well, I want to thank you so much for being with us today. I hope our viewers learned something about monkeypox, and that still that distancing and quarantining and knowing who you're associating with is still extremely important during this time. And
Yes.
again, using protection is still also very important for people who are spreading this through sexual acts. So I want to thank our viewers for tuning in today, and we hope you'll tune in again next Wednesday at the same time.
I hope you enjoyed this episode of the Dr. Vicky MD Show. Join me next time as we continue the conversation. The Dr. Vicky MD Show streams live every Wednesday at 4 p.m. Pacific Standard Time and 7 p.m. Eastern Standard Time. The show welcomes suggestions for future episodes from our virtual studio audience. So don't hesitate to contact me at my email, drvickymd@gmail.com. If you enjoyed what you're learning, don't forget to hit the subscribe and like buttons so we can bring it to you every week. Tune in and join the next episode of the Dr. Vicky MD Show.